Hi, good afternoon, morning, whatever time it is
It is still
watching
morning.
it.
It's Tuesday, so it is still morning.
But whenever you're watching it, who knows? It could be.
Well, and you may be seeing it at a later time because we do not do our live broadcasts anymore. But welcome to our Tuesday Tooth Talk.
Yes, and
Dr. Brian Amison.
Dr. Richard Huetter, and we have our special guest, Rebecca.
Okay.
So we're going a little different here. So today we're going to talk about oral cancer. So I just went to a seminar a couple weeks ago, and people think of us as dentists as just looking at the teeth, right? That's what they.
Teeth and tongue.
Right. So it's a little bit more. that's another one. Tooth talk, teeth, and tongue.
Oh,
boy, 3 times fast. But anyway, so and Devin's recording, so you can tell we are just really professional here.
We are. I mean, it's a serious subject,
It is,
but we
is.
want to ingratiate ourselves to you. So we're trying to be pleasant.
Yes.
So, oral cancer. Dr. Amison recently went to a class, a course, and learned a few new things, some emerging events in oral cancer. So, and he learned some things. So, I have yet to learn all those things myself. But you can see things in the papers, or whoever reads a paper online, in the news about some kinds of oral cancer. And that's primarily what Dr. Amison was learning about, related to a virus, of all things. So that's some things that he's going to actually demonstrate, perhaps a new way of performing an exam extraorally, actually outside the mouth. Although, of course, we're always going to be looking inside the
Correct.
mouth, as we've described in a previous tooth talk about what we're looking for: white things, red things, blue things inside your mouth that don't normally exist there. So those, sometimes are triggers for us to pursue further research into what your particular condition would be, why that would be. But what he's going to demonstrate for us is, like I said, an extra oral exam, and he's like I said, learned more of this, and so that's what we're going to show. And so, Dr. Amison, you're up.
Thanks. So oral cancer, think of oral mouth. So we're looking for mouth cancer, and as Dr. Huetter mentioned, red, white, or blue. So I always say think of the American flag. So, but with the seminar, they talked about oral cancer actually is decreasing. So again, that's kind of restricted to the mouth. However, tonsillar cancer, throat cancer is increasing. So why would you ask that oral cancer is decreasing?
Less smoking. That's
Yes.
primarily a driver. I mean, the rate of smoking is significantly decreased. And of course, smoking is a primary driver of oral cancer.
Correct.
Alcohol is another factor. I'm not sure that that's exactly decreasing, but at least the smoking part is. So I would say that that's probably the primary cause if I had to guess.
And you're absolutely right, sir. So due to the decrease in smoking, cigarette smoking, we won't talk about marijuana,
Right.
that's a different subject there. But what's happening with the tonsillar cancer is increasing because of, again, the human papilloma virus, the same virus that causes warts. And what we found is that when, Dr. Huetter and I, we look in your mouth, we're looking back for your tonsils. But did you know that actually the tonsils are actually part of your tongue as well, the very back part?
Well, I knew that, but not everyone would know that or recognize that. And if you had your tonsils removed for some chronic condition, which of course used to be far more common when I was young. Every other kid was getting their tonsils out. So, but that's not the case anymore. Now there have to be established protocols to get into that. But that's not our point here. Dr. Amison is going to elaborate though on that.
So, well, what I'm gonna do is, poor Rebecca's sitting here, she's being very calm and everything. I'm actually gonna just show you kind of what we do for oral cancer exam. So it's gonna be a little different. I mean, for those of you who have seen this before, we will fill the neck, but I'm gonna show you a little different way that we're gonna do it so that you're aware. So again, Rebecca has, I don't know if you volunteered, but she is our patient. So I'm gonna show you what we're gonna do. So first of all, my mask on here. Okay. So what we'll do is I'm going to sit you up, Rebecca, a little bit, and we're going to lean you back. So again, what we're looking for is any any spots or any lumps, bumps, or anything unusual. So I'll kind of go through the first part of the exam where we've done in the past. We checked the jaw joint, lips, tongue, cheeks. Then I'll show you our little added exam for the neck. So here we go. So first we're going to check the jaw joint. So Rebecca, have it open for me as wide as you can, and bite down, and have it open, and bite down. Any pain at all?
No.
So for that, we're looking at the jaw joint here. So we're looking to see if there's any like kind of crunching or popping or pain. So good job there, Rebecca, that's great. So now we're gonna check her cheeks. And we're just feeling around again for any lumps, bumps, or anything unusual. This is the parotid gland where if you start to get salivate, that's where it starts here. So we're feeling for any lumps. So that's good.
It's the parotid gland is one of the 3 sets of salivary glands, and it's by far the largest, and it's also the place where in the past where people got mumps, that's what mumps was an infection of the parotid gland. So that's why it would look like your cheeks were swollen on the outside like a chipmunk. That's what the parotid gland is. And still occasionally can get infected, but it wouldn't be mumps. Usually there's another factor involved in causing that kind of infection. So that's what Dr. Amison was looking for.
Correct. And then we'll go to the part where, again, we're going to check Miss Rebecca's neck. So again, feeling around the chin area, and feeling around underneath the jaw. Feel for any lumps, bumps, or anything unusual. Now this is the part that's a little different. In the class, we talked about seeing your tonsils, and it's so far back that it's hard to see. And in fact, even though that's our realm or area of expertise, it's hard to see in the throat. So what we found is that if there's any type of tonsillar issue, type of potential cancer, we'll feel bumps on the neck, so the lymph node. So what I'm going to do is, I'm going to have Rebecca turn to the right for me. So I'm going to feel the side of her neck there. So again, I'm feeling around there and see if there's any bumps. That side, then I'll be turned to the left, and same thing. What a great candidate there. Look at that muscle there. Wow.
Maybe it's, I don't know if you can see
Yeah,
it.
I don't know if you can see it there.
But, yeah, that string there that we all have, of course, is the sternocleidomastoid muscle, SCM. And that's where Dr. Amison is actually palpating. And that's why, that's where that tissue might be, or the infected lymph nodes associated with that.
Right, like right underneath this area. So before we just feel here, but now we kind of feel this area. So if we feel any bumps, then what we do, you go ahead and look straight ahead. Okay, so with that, if we feel any bumps, then we would, get you to your ENT, and then they can do a further check. Because again, we see in the mouth, but the tongue, we can only see so far back. So as I mentioned, what we're finding is with the tonsillar cancer, it's behind the tongue, way back there. And I'm not going to pull Rebecca's tongue all the way out there. We're not going to do that. So then in the last part, I'll have you open for me. And then go ahead and say, for me. Now I know you can't see there. And Devin, we should get Devin on tape there. But again, we're checking there to see if there's anything, you get red, white, and blue, any lumps, bumps, or anything unusual there. So to summarize, the bottom line is this. We're looking for, any type of masses, so it's more than just the teeth. And we said this before, one of my instructors, I never forget this, he's like, look, you're not a tooth doctor, you're looking for the mouth. So if we see anything unusual, we will let you know. That's part of our role. It's not just the teeth, but the rest of the mouth. So again, what you can do at home, same thing, look in your mouth once a week. Stick your tongue out, look around, red, white, or blue. And also, you can see what we did with Rebecca. Turn your neck, kind of feel those areas there. There, if you feel any soreness, again, let us know. Now, it's not necessarily our expertise, but we find that people will come see the dentist more than their physician. So if we can aid in, overall health, that's what we're going to do. So that was a quick rundown. Thank you so much, Rebecca, for being so such a great patient. Thank you, Devin, for recording there. I wish I could we should record.
Hi.
Dr. Richard Huetter.
Dr. Brian Amison.
So thank you and have a great day.
Have a great day.